Most people think that healing begins when labs come in or when supplements begin, but real healing, it actually starts with being seen and being heard. And often what a person can't say out loud is really where the work begins. In fact, 1 in 3 patients say that they hold back key information from their doctor. Why? Fear of being judged or dismissed, according to JAMA Network Open Study in 2018. People don't share when they don't feel safe, and my job as a holistic provider is to create that safety and not rush the process. Peace and welcome, Dr. Steele here. Today, I want to share with you one of the most important and often overlooked skills that I use as a holistic doctor: listening to what my patients aren't saying. If you're new to my channel, welcome. We are in week 9 of Intro to Holistic Medicine, all about case taking. If you want to join this free course, feel free. Go ahead and click the link in the bio, scroll down and enroll. It is 100% free and self-paced. You can jump in at any time and follow in. All right, perfect. So when I sit down with someone, especially during a first consultation, I'm not just listening to their words. In fact, I'm really tuning in to the way they speak, their posture, their eyes, their breath, their pauses in between sentences, their word choices, their emotional state, all different factors, right? And so some patients come in with a long list of symptoms, but there's a lot of patients that downplay their symptoms either. Others smile through exhaustion or minimize the pain, and some really are totally disconnected with any trauma that they faced. And so that's not dishonesty, it's really survival, actually. And that's masking. And it's my job to hold space gently enough that the truth can come up. Sometimes the biggest clue isn't actually the symptom itself, it's the emotion behind it. If someone says, I just want to feel normal again, they say it 3 times in 10 minutes, that's where we maybe want to begin, because that's a longing, not just a phrase. And I don't actually rush the fix. I listen until the body and the story meets, which sometimes can be frustrating for the patient if they're in that quick fix mentality. But there's a hidden language of trauma and conditioning, and many people are conditioned not to ask for help, or they've been gaslit by so many providers. By the time they get to me, they're really scared and shut down. Or they've learned to disconnect from their bodies altogether, disassociate, just really as a survival mechanism. So when they say, I don't know what's wrong with me, what I really hear is, no one's held space for me to be heard yet. No one's truly seen me. So, for instance, I once had a patient who came in for digestive issues, but what I noticed was how she clenched her jaw, crossed her arms, and even avoided eye contact. Instead of jumping into a protocol of supplements and labs, I slowed down and asked, when did you stop trusting your body? Of course, being seen, heard, she instantly broke down crying. And that moment taught me more than anything that a lab could. So if you're studying holistic medicine or just trying to heal, you can start practicing this right now. Notice your language, ask, what am I not saying? And reflect, where do I feel this tension in my body when I speak, right? So in conscious communication, we go, I give myself permission to feel in my body and it's okay. I give myself permission to be in my body and it's okay. And this allows us to really reclaim our power and get present in our body, because otherwise, if we're not fully present, we're not going to be connected to the clues that our body is telling us. Because it isn't just about a diagnosis. I know everybody is obsessed with diagnosis. They want that label, but oftentimes that label doesn't bring about healing. In fact, it never brings about healing, because a diagnosis is just a sophisticated labeling system. It's not a pathway to healing. It's really also about deeply listening to the body, honestly witnessing and honoring the body. So the body holds memory. We know it keeps the score, and the voice carries emotion. In fact, we use different tools to be able to actually measure the voice frequency to see what is going on with not only the body, but also the subconscious mind. Healing begins when someone finally feels heard and they feel seen. That's the sacred art of consultation, and that is at the essence of holistic medicine. If this spoke to you, share it with somebody who needs a different kind of listening. And if you're ready to begin your own healing journey, join me inside the Intro to Holistic Medicine course, or even download our Holistic Life app, or even book a discovery call, because we're building care around connection. So go ahead and drop a comment below after you've liked and subscribed. What's something your body may be trying to tell you that your voice hasn't caught up to yet? I'd love to hear it.